And kids and teens are in a mental health crisis. And today, CHI Health told us they're seeing a big spike in anxiety among younger kids.
Behavioral health appointments and crisis call lines have significantly increased so much recently. The hospital is trying to make parents aware of triggers, signs, and what help is out there. 3 News Now reporter Isabella Basco shows us why that is and what can be done about it.
During the pandemic, a lot of folks were quarantined. There was a lot of remote learning happening for students. And so telehealth really gave access, to students.
There's an enormous surge in patients 18 and under asking for help. In the CHI Health System, behavioral health appointments for kids and teens are up nearly 25%, and calls into their crisis line are up 70%.
In addition to, part of that quarantining and that remote learning, persons were socially isolated, and social isolation can lead to increased depression and anxiety.
Mental health experts say increased screen time and social media use are reasons for the spike in anxiety seen in kids and teens.
There's social pressures around it, trying to fit in, bullying, those types of things, and young people, they're trying to learn how to manage that, where as adults, we've had more years of life experience to know how to set boundaries.
Dr. Zachary Keller, a psychiatrist, says parents need to maintain consistent communication with their kids.
If you notice your kid is not acting like themselves, and even when you try to pry and they're like, oh, it's fine, then it would just continue to kind of paint the narrative that you need to continue to kind of press it, or make sure they at least have enough support in terms of therapists, school counselors, friends, or other adult relationships that they might be more open to.
Ultimately, Keller says focusing on the mission and not the goal is important to maintaining your mental health.
Whether it comes from self-care, medications, therapy, maintaining healthy boundaries, removing toxic relationships, etc. That's really all you can do.
In Omaha, Isabella Basco, 3 News Now.
CHI Health unveiled a digital version of their magazine called Better You, Healthy Minds. It offers advice to parents and educators, and we have a copy of it on our website.
So why is this a big deal, and does it impact your family? Let's take a deeper look. Kids and teens dealing with poor mental health may struggle with school, decision-making, and their health. According to the CDC, mental health problems often go hand in hand with health and behavioral risks, increased risk at drug use as well as experiencing violence and higher risk sexual behaviors. Because many health behaviors and habits are established in adolescence, that can carry over into adult years and is very important to help younger people develop good mental health. Now, there is good news in all of this, especially after the last year we have seen just how resilient teens are. Fortunately, the same prevention strategies that promote mental health, like helping students feel connected to school or family, also prevent a range of negative experiences like drug use and violence. It's important to build strong bonds and relationships with adults and friends at school, as well as at home and in the community. Connectedness helps teens feel and know that they are not alone.